mwasiba mta abari kutureba aha Revival TV na niwe oturukize aha Revival Radio wasibota ryaringa buhoro kwe. It is a blessing kugaruka kurebana ishahankezi program neberi Amagara N'Okubagye kurugashayisha tukuza shahina kandobo noboine nyowe umtewe kanisa wawe believe aina mani nsimbana hanga owaterezo mugisha kugaruka kurebana kandi kugaruka kwija kwega ahabikwatirine n'amagara gitu program agent bantu etegereza uko amagara gitu shemerega twaza kugira ngo agume gari hamutindo ngabagine kubaje kandi kugumana garebe kaje kurunji nitwe tukahurira turukurunji kugira ngo tuhimbise izina rya Mukama. Mwe bare kutwegitaho mutabarice yoko mmerumehi mwasiba ndebe mwabana mukora byona program Amagara N'Okubagye twasimara hanga habweri izoba ahabo kubantu isha kubantu sharinga aha bintu bimwe na bimwe ebituyire ni byafectinga amakagitu abacara bitu abashaija bitu hazemwe ebiretire amakaga tagenda je nko kugashemerire kubagari erizoba ntusha kugamba ahanshonga ezuru kuretera enda zitu zagumana zirgamu omchara na jirenda enda irgamu ajirendijo irgamu mweno shangangu ekatiyaza mu businje ahabwe nshongejo konkeri izoba ntwenda tumanye nikire yetwachi kandi ntwenda tugarura masiku kugira ngo toruwenka iwo ucibira cyashikireho toruwenka bitu families nyinja heroko zurumunzireba obuzubu nubwe bumwe konka habwe mbabazara hanga tuija kucigamba heri izoba kandi ntumanya ngo iwe uri nitwe izoba uja kugira cyo wayega mweni yetebekanise kwataka chimukawe kwata urupapura rwawe ohandike ebyo obundi bikagira okubya kwera umukombeka amakagawe erizato hebo mjishato atayisa umshaho witu okurga Ruharo Mission Hospital ushemwe Dr. Edwin Semambo nuwe utwatayisa izoba erianyakazoba nembabazi kugira ngo turiniwe Dr. Twakushemerera.
That's the right one.
Yes.
Thank you very much for having me, Believe. I am happy to be here. As you've mentioned, my name is Edwin Semambo. I'm an obstetrician gynecologist working with Ruharo Mission Hospital.
Thank you for coming and for being with us. Omshaho witu Dr. Edwin Semambo nomshaho urukurebera urukora department ekwataginena na ebyabachara ebikwatirine ebyo kuzara ebicweke ebyo mwene rizoba nico yiza kutuganirira ahanshonga habwachi abantu enda zabo nizirgamu nizigumana zirgamu ekirgame yo kubaza hargame ya kabiri hargame ya kashatu ekiturukweta recurring pregnancy loss erizoba nico turkwenda kugambaho reka tubaze tushabe tsimehor hanga habwa izobe abishahezi iziyatwereza. Let's pray. Twakusima Yesu Kristo twakwebaza ahabwe imbabazi zawe zo tugirira ubutosha Kristo manyani kirungi kugaruka kurebana yebara habwe gishaha kugaruka kutureta hatukarebana yebara habwa Revival TV na Revival Radio na management yona kutandikira aha founder the Right Reverend Associate Professor Sheldon Mwesugwa ntukusima ahabwabo bona abajinemo mukono umukutunguka kwayo nabakozi bayobona mwene Mukama umshahejo program y'Amagara N'Okubagye ntweta ngo jogambe nitwe moyo rkwera terezo moyo wo kubyetegereza ebi umshahara tushobore kandi bebyo kombeka amakagitu n'amagara gitu obutosha bwona izina ryawe rigumenera himbisubwa Kristo Mukama wetu. Amina. So doctor,
Yes.
tuine kutandikiraho and now we want to understand what is a recurring pregnancy loss. Choni chochi.
Thank you very much.
Yes.
As always, I will be using some bit of English where possible in Nyankole and our Luganda. Because the name is Emmanuel Bulungi. So pregnancy loss or recurrent pregnancy loss, as we are talking about it today. Nchimanyisa omuntu akurugwamo endiviri kutahigura. So omchara wafune nderizoba yarugamu then wafuna endijo nayo yarugamu once there are two omo omukyala avamu embuto bbiri okudda waggulu we call it recurrent pregnancy loss. Nchimanyisa ngu zirugiremu zikuratine. I hope that's the right word.
Yes.
Ngu zirugiremu zikozireki zikuratine. Hence the word recurrent. Recurrent means one after the other. Yes, and it is common, and it is one of the things we find. And one of the challenges women get, and most of them usually want to know, is it me with the problem? Ninya inechize bu doctor, echichechi kuretere zenda zanje kurugamu na nevyo. So it is something common. Konga in definition tujirango endibiri ezikurugamu zikozireki zikuratini.
Hati doctor narwa mwenda nkagire ndijo nkazara. Konga nkagire ndijo yakashate karagamu. Na yejo neba yaza recurring pregnancy loss ninga echo nechindi chintu.
It's a technicality konka nayo neveri pregnancy loss.
Okay.
It still qualifies because ideally you should be getting pregnant and you
give birth.
And you deliver. So even when you have a delivery in between there, but you lose the next pregnancy. So it still qualifies. Nobochi in what we call recurrent pregnancy loss.
Oh, yes. Now, ntoyebuza. Ninyebuza. Ninshongachi ezirukuretera enda zaguma nizirgamu. What are the causes of recurrent pregnancy loss? Yes.
Thank you very much. In English, we say this is the gist of the discussion.
Yes.
Yes, so okumanya. And I just want the people out there to understand that there are quite a number. Bintu bingi si kimu kyokka. Ate engeri yokka gy'oyinza okumanya ki kuba kukebeza.
Yes.
Ekisooka embuto zisobola okuviiramu ku myezi egy'enjawulo. Nobasa kurugwa mwenda zirya myezi zitakushana.
Yes.
Omwe yarugwa mwenda erya mwezi gumwe, myezi abiri, myezi ashatu. Then abandi nizirugamu zakuzire ziryo myezi 4, myezi 5 na 6. The causes are not the same.
Yes.
Okay. So usually abakyala bakukira kurugwa mwenda zirya hansi y'emyezi 3 ninga myezi 3 and below. Usually in certain conditions that can bring them. Echokubanza in English ncheta chromosomal abnormalities, ninga genetic abnormalities. Nchimanyisa ngu omukura kwa mwana or in the formation of the baby, there are things that didn't go well. He no tafari obuineho nkechizibu, so to speak. Tibwakwataje ninga omwana tiyaformingaje according to how the body is supposed to be formed. So those genetic and chromosomal abnormalities, they contribute a lot. And they are one of the leading causes, especially endezikurugwamu zine myezi 3 and below. So 3 months and below. One of them is chromosomal abnormalities.
Okay.
Yes. Then ekyakabiri hariho abnormalities omuri nyinenda. So there are things that happen in the uterus that may cause people to lose pregnancies. Ekyokubanza abantu abine ebizimba. Tukweta fibroids. Ebizimba bikyankalanya munda munabaana. So that omwana tafuna weyekwata bulungi. Weyandyekutte akulirewo olwokuba waliwo ekizimba teyekwatawo bulungi.
Okay.
Then waliwo abalina n'abaana ezirina ebizibu oba nabana ezirina anomaly, we call them congenital anomalies. Waliwo abalina nabana nga tezakula bulungi. In English we call it biconnuate. Zibanga ezagala okweyawulamu naye nga teyeyawuddemu. Then waliwo abakyala abalina enkovu munda munabaana abamu bazifuna olwokuba babooza munda.
Doctor,
yes,
wait. Wagira ngo hariho bokushanga nyinenda etakuzireji. Nebaye nukwe yakuziretyo ninga nikija kibaho wakuzire nko mukazi at like at 26 or whatever age, then kugira ngu nyinenda yawe. Therefore, Modiji, does it start as you're growing up, like it's formation?
Usually it is congenital. We call them congenital anomalies. Okazarwa nacho. It didn't just happen. Yes, haro abine what we call congenital anomalies of the uterus are either biconnuate, never. It is almost splitting, but then it is not split. Then haro abinibidi, then haro abine nyinenda konkerumu akabubyo or hagati and things like that. There are many congenital anomalies that come because of formation as someone is growing. So it is not that it comes later in life, but some people were born that way.
Now,
yes.
Does that mean that is there a chance yomuntu oyine nyinende kuziretyo kwija kuzara?
Yes.
So hariheme bazayimo kwija kumuhereza ikamutereza nyinendo mwana akaza makakurira muje?
Apana. But the uterus is stretchy. And Kamuruganda is how we say. So if there is enough space, ninga sometimes if the pregnancy goes in a place with enough space, but there are also surgeries that can be done to put some of these abnormalities. Okay. Right.
Okay.
Yes. Then one of the things people ask about and hear most is infections. How infections either if you have them for a long time, or they are difficult to treat, or you have them and you don't know, they will cause pregnancy losses.
Yes.
Mostly, haro abineza STIs, sexually transmitted infections, urinary tract infections, malaria, syphilis, and things like that. All those can cause a woman to miscarry or to lose a pregnancy. Okay. But it is not always that the infection is what has caused it, as we are seeing. Yes, it is just that sometimes someone comes with that condition or with an infection having happened, and if they don't treat it or if it stays for a long time, there is a possibility.
So, actually, abinji kakuba nargamenda atekatika ngwa ine infections. So mwenu ni chances ziri kwingana chi infections kuretere na yargam?
I'll say 50%.
50%.
There is a high likelihood.
Oh.
There is a chisoboko kubanti infection ye chirese.
Okay.
Nete chitegeza nti buli kaseera infection yebekoze chi.
Okay.
Yebe chirese. Then ekirala emyaka y'omukyala. Omukazi akurenze emyaka 35 sure. They also have an increased risk ezokurugwa mwenda. Because myaka 35 ningo omukazi kakura ningo omuntu wena kokura, how you are as a girl or as a young boy is not how you be. Ebintu nibiguma nibihinduka. The quality of the eggs nibihinduka, the quality of the hormones, the levels of the hormones byona nibihinduka. So when all those things change, the quality of the egg you produce is not as good. So chances of you getting the chromosomal abnormalities or the genetic abnormalities we talked about are high.
Okay.
Yes. Then on the men's side, also age is one thing. Because still the quality of the sperms reduces. Yes. And once you give abnormally formed sperm, once you give sperms that are of low quality, then they are not going to give you a good fetus. Then you get the chromosomal abnormalities and things like that.
So women 35 and above. So for men, how old?
Usually we say 40 and above.
Oh.
We usually say 40 and above. But it can happen earlier because of lifestyle.
Yes.
And we've into that we do as people that actually change the quality of the eggs, change the quality of the sperms. For example, people that smoke.
Yes.
Yes. People that drink a lot of alcohol. People that do drugs.
Yes.
So they alter the makeup of the eggs. They alter the makeup of the sperms. They increase chances of us getting the chromosomal abnormalities. Okay. And therefore people are going to come with recurrent losses. Me, my pregnancies, me this, but during pregnancy or even before pregnancy, you had this insult, wanoresa, wanonyamara, you are taking a lot of drugs and things like that. So they had a lasting effect.
Yes.
And they keep disturbing you. Then nutrition during pregnancy.
Yes.
If someone is not feeding well, the stress on the body is obvious. It is right there. Yes, and then the body cannot support the pregnancy. Yes, then there are other people that will have what we call hormonal imbalances. Yes, or hormonal issues or disorders of some of the hormones. For example, shukari, diabetes.
Yes,
it usually causes that issue because diabetes itself causes, in English we call it inflammation, chronic inflammation everywhere. So which means even the uterus is inflamed and it is not suitable for implantation. Okay, then there are conditions like antiphospholipid syndrome. Those ones usually you have to go and they test.
Yes.
So that they find, and they are common, it's just that we don't usually look for them. Then people that have commonly these days about PCOS. It's called polycystic ovarian syndrome, or these days they call it polyendocrine metabolic disorder. Okay, so it also causes those issues because in PCOS usually what happens, in resistance to insulin.
Okay.
And when that happens, even your hormones are not formed or they do not work as normally as they should. So no shanga omukazi takuza mu mitwe gye, then omukazi amahori tegakurugayo and things like that, so they can't get pregnant. Or when they do, the hormones are not enough to support the pregnancy, so they lose the pregnancies. Then other chronic conditions, of course, nk'abantu abine endwara za kidney conditions, kidney diseases, abine pressure, and some of those conditions, they also affect, first of all, fertilization, conception, and eventually the pregnancy itself.
Okay.
Yes.
Thank you, Doctor. Yabari kutushabora je kurungi ebyo birukuretera enda zitu zaragamu. In Africa, narshi generally in Africa, abashaija ninga families ko kushanga omukazi nakira kurugwa mwenda, oshanga the in-laws, the husband bona barumba blaming, bamharasinga that nowe arikuretera enda zaragamu. Is it true omukazi no contributing mnonga ahanda kuragamu?
I will say it is not true.
It is,
it is not true. Just like in getting pregnant, it takes two people. In English, they say it takes two to tango. So everyone has a contribution.
Yes.
Okay? As we've realized, or as we've discussed this, the chromosomes that make up the baby are not for the woman alone.
Yes.
They are for the woman and the man. So each one of them has an equal contribution to that. Buli omu alina kyasobola okukola ki okugattako. So si kituufu okugamba nti bakazi be babereesa ebizibu olumu kiyinza okubaawo nga sperm z'omusajja ze zitakoze nga bwe nkugambye, the quality of the sperms is poor, so we get genetic abnormalities even when the woman has good eggs.
Yes.
There are other male factors that can contribute. Yes, but it is not. The only challenge is that usually it is the women that get pregnant, so it is them that lose the pregnancies. So my information will be just like infertility is not just about women. Even pregnancy loss is not just about women. It can go either side. We can all contribute equally to the cause of the loss, as we've discussed.
Okay. Yes. So nikimanyisa ngu tuije mu irwariro nyo n'omushaija wanje tutwire nturugwa mwenda numubasa kuchebera mumanye ngu omushaija nuwari kuretera enda yaragamu.
Yes,
you can tell that
we can tell because the things I have talked about ninga bitwagamba ebikuretereza abantu kurugwa mwenda byona ntubasa kubichebera mu marwaro ntubasa kubichebera. So infection ntubasa kubichebera kandi both people can get infection.
Yes.
Ekya kabiri chromosomal abnormalities, we can check the quality of the sperms, we can check the quality of the eggs.
Yes.
So that we know. So and then we get to that issue. Maybe another thing I forgot that I think is important, the way I said that abanda bakukira kurugwa mwenda amyezi ashatu kuzahiguru, it's one of those things hina bakurugwa mwenda zikozire myezi ana, myezi atano, myezi mukaga.
Yes.
There is a condition yetukweta cervical insufficiency. Nemanyisa ngu nyinenda y'omuntu teine maanyi gakukora ki
holding fetus.
Buri mwana buri yenda kekura obulemezi nibweyongera nyinenda nekora ki newa maani nekora ki neigura enda neragara. That's possible. It's called cervical insufficiency. Now that may be one of the deficiencies a woman may have. Konka, there is still management for that.
Yes.
So omuntu kakwija mu irwariro taking a history wamwexamininga wambuuza byona yabikugambira yakugira ngu ezanjye nizikira kurugiramu amyezi 5 ninga yokubanza karugiramu amyezi 6 then endije erugiramu amyezi 5 endije erugiramu amyezi 4. So as a doctor you weigh and find out.
Okay.
Then there are things we can do. Yes.
Okay. So now as a couple nyowe n'omushaija wanje tushemereire kwija ryaro mu irwariro aha nshonga ya enda kuguma nergamu nizirgamu. First pregnancy, are we supposed to come to the hospital or we should wait? The second pregnancy, nayo kera arije tubone kwija mwene tushemerire kwija ryaro mu irwariro.
Okay, as much as twagirango recurrent pregnancy loss nikimanyise ndivire kuzahiguru, it does not mean that the woman should wait for 2 pregnancies. Okay, so omuntu wena kurugwa mwenda aine kuzahirwara even when that condition is happening. Okay, so that they get managed. We've talked about it before and said omuntu okurugwa mwenda, you need to go to hospital and make sure you are okay. Sometimes bleeding may not necessarily signify ngwenda ya rugamu. There are different ways enda nebasa kwenda kurugamu konka egumamu because of certain treatments and everything. So my advice would be buri mukazi weno inenda at the first point kokumanya ngu I am pregnant okoreki ozahirwara. Then warugiro mu irwariro watandikire bya antenatal waboryaho then watandika kujo watandika cramping, abdominal pain ningo kushasha omunda nkeke okoreki ozomwirwariro. Then at any one point enda bakugira ngo enderugiremu bakumanaginga wakira, have that discussion with the doctor. So don't wait ngo zibanze wayisiye biri ninge shatu then ubone kuza mu irwariro hapana.
So no basakurindaho kugira tekate maybe hiniche nakora ningashi. Actually there are some people who say ngo enda yanjerigiremu habo kugira ngo shitwire ibintu biri kuremera nkoziremera mu minji. You know, it's called a myth, something like that. Is it true that na wakore bintu byinji washitore bintu bikoremera enda yawe nebasa kurugamu?
Yes and no. Yes, habokuba the first 3 months as a pregnancy and a very delicate. I don't know delicate omurunyankore nimukigamba muta
neba echorobe yorobi.
It is very delicate in that you don't need stressful things, lifting heavy loads, not sleeping, moving long distance, actually fragile, delicate. So any stressors, not just lifting heavy things, but even if you don't rest for a long time, if you are always fatigued, you don't get enough rest, you don't eat well, but it is not, and then no, it is not just that but especially the first 3 months, you increase pressure on. So there should be some effects in there, but it is not 100% ngunyweke nkwinde bikoremera ndanekora ki neraga
because haro kuba oine omuntu someone you're talking to them and they tell you because I was overworking, that is why I lost my pregnancy. But I think you have explained it beautifully. Kandi mpamya that someone out there yayetegereza okushtora ebintu byinji cyo cyukuretera indayargamo beitu oriyaha Revival TV na Revival Radio program Amagara N'Okubagye nokwe tukuba turumu kurgashaisha tukuzashahina utoshabona utakaferwa ntubatwinire intanda nonje munonga namwe nakatubanze tuzo mu burango tugarucene binde bikukiraho.
Nice. There is a lot to talk about.
Revival TV, Amagara N'Okubagye.
Are you looking for affordable residential, commercial, or agricultural farmland in Western Uganda? We also have great commercial land and agricultural farmland offers. Our payment terms are convenient for everyone. Come to our offices today, located at Chosiga House, Makansing Street, Mbarara City, or call us on 0777 564 588 or 0755 282 898, or send us an email via info@amitug.com. Come with all your land needs. You will live with the most convenient solutions. Amity Realtors Limited, your closest partner in land needs.
Ababanira CCTV cameras abarukushango mu rurembo rwambarira bagarukana insurance ababanira ubwa hati bine card cameras ezikora ikiro n'ihangwe kandi zikureba uburingo bwa meters 20 nankaga alarm cameras smart hybrid 5 megapixels cameras PTZ cameras bine DVR na NVR eza 2 megapixels na 5 megapixels hard disks bine na za cameras zindi ziri kuzabikondo bya solar n'eby'amashanyarazi kandi cyo mutano kamera zikuzabikondo zibazi gitureho wifi na internet bagigita simu yawe yo mu ngaro kandi ogwe rikosa memory card bine byome bikubara senti hariyo wa bank sako nangwa no mu bukwate motoka yawe wete tracking devices nibaburiyo bashanja office zabe nkuru ezikushango mu rembo rwambarira wabanotaho mu gate ya Baspa na Amazon building opposite Stanbic Bank ninga shotere no tumushanju mukaga 88 na no tumushanju 52 88 ejo nisaba banira urinde byawe nabawe
Oryo mweshongozi notandika busya ningo twire no yeshongora kunka ibyeshongoro byo bibura ku byahika ntango bunda abantu tubaru kumanyangu oryo mweshongozi receraho kubonabona Revival Music Audio Production eriyaha kwera eine ba producer barungi ibyeshongoro byawe bimanywe izina rya hanga ryongere kwimusubwa Revival Music Audio Production yeja kwera yeshongore ohimbise mukama rero izina rya hanga ryongere okwimbisubwa torokwera kandi kurikodinga ebyeshongoro byawe kurebeka ngo byeja sound rukuhisarhanga HTNSA kandi n'abarabihurire weza bakahurira n'abahebwa umugisha tushanje aha Church Hostel Mbaguta Street Proti 50A na Shotere aha notumshanje 8 19 anana nari aha notumshanje notina notumwenda abernamkaga ananamshanje koze sa Revival Music Audio Production oikehona
Otafir wa Revival TV
Burkai nebitebyo okuremerwa nembere kwindura amagaraga abantu bamwe konko bumwe amakandi getengo bhabuzi okuhumurizibwa n'amatsiko
program eka yawe natubantu ganira okutwakubasa kugira amaka gakuhamere tukorera jabana bitu kutunguka n'ebindi bingi
kutandikira abushwere no korora abana kusasirana no kwikereza mu rumukama
kenji no shanga maka bwijwire mba single parents ubundo shanga ryo mukazi aruwenka nayo rabana konka ningo bunda ryo mushija nawo mukaza murekira abana aruwenka
icyo kubanza cyabiyona okutina mukama
nukutingira byingi kandi kushemeza umutima
gabana nitwe aha baremezo bwoyine abahumuriza bitu bariho kwera
kwatanise nituza kumbeka amakagara mu ruhanga
nyegitaho on program eka yawe nanye Irenina ugumosheri
utaferwa program eka yawe ku rugo rwa kabiri kuzuru wa gatanu shayitano kuzamu kaga zihangwe aha Revival TV amagara mu bwijwire.
Izina na Amarajo Vretsenja omuburizi wa All Saints Church Kanyeganyeje aha Uganda Bati kisha kujimanyira ahari munywani wanje akakozesa amabati gabo yangambira oburungi bwabo worukuzayo kubahagira bakwa transport nibakuretera ebintu kandi bagaruka bije omurimo ogwo bagukora kandi ekindi ebyoma byabo tibikukyerenya ningambira abaturukirize owakubasa kuba nayenda kwombeka nk'enju ye akozese Uganda Bat abo kuba eine ebintu birungi eine amabati marungi eine ebyoma birungi biine n'abaheereza barungi.
Ultraspan, durability and strength you can trust for ages. Uganda Bati, Uganda's most trusted building solutions partner.
Otaverwa ha Revival TV okurwo mu itaka riturukubataho butosha okuhika habyo kurya bikuza hameza zitu. Uri musharuro nugutandika n'ubwenge no kwegesa
tambura nanye mu program eki ubwo tushika ahabarisa batarabona bamwe n'abahinji batarabona bamwe kwega empinga n'endisa ezo murenge ubwo twitebekanisiza okusharura cyangwa
obwirobo nutuza kuba ntubugana abahinji n'abarisa aha amafamu gabo rero tweje hamwe
mumbwire bwo mushana mazima itonka abahinji b'urutoki ngo twata kubi ahubwo kuba imitumba yona negenderete amasansha akugira ngo hanse na hantu hose yamununga
nituza kwega imiringo itari yemwe nemwe yo kuhinga ibihingwa no kurisa amatungo
obuhinji tumuringo gwamagara giti chonka kweka n'urukizi rwa nyensya yitu
itaka n'obutunji burwa mukaga kwihashahi 12 zo mu mwabaze aha Revival TV amagara omubwijwire. Revival TV amagara omubwijwire.
Yes, welcome back. Mtabariche yoko mbarango kandi program neberi Amagara N'Okubagye. Tuba turi aha kugarura amasiko namwe niwo mukazo ryokwe urumuna utureba Revival TV. Nengo turikiza Revival Radio. Kora abo twire n'urugamenda. Torwenka. Konkeriza kugira ngo apana humura tuja kugarura amasiko. Kandi bakushobora enshonga zone zikubasa kurete kintu nk'icyo cyabaho. Kora noreba muri yezo zumwe hine yoyine yirukanga wishemwe ozahirwaro oreba umushaho kandi umushobore nko kubiri kugira ngo ohwerwe kandi ugaruka mubuteka. Yes, doctor katugumize mu kutabatahika ninyenda kwetegereza je hariho bwo rukushanga ngo umuntu yargamenda ahabwa emotions ninga someone is having a psychological trauma or something charetera inda yargam. Is it true? Like it's a say when no jirana mazima.
Yes, namazima nchivasika umuntu nabasa kurugwa mwenda because of emotions.
Yes.
For example, nka stress is one of the emotions. Twine hormones omubiri that are released because of stress. Okay? So those hormones, first of all, they can cause women to not have menses or to delay. Nobasa kutirango periods zadre ngabo kuba na and stressed. So they have that effect on reproduction. So in the same spirit, kokuba oinenda, the same hormones that are supposed to maintain the pregnancy are responsible for bleeding, are responsible for ovulation. So kokuba or stress to inenda, the level of those hormones will reduce, which will make the pregnancy most probably be lost. Then her whole emotions as in you're depressed, I am not okay. You can't take care of yourself. So you will have deficiencies in feeding. You will have bad lifestyles and things in kebyo, koresa, kunyamarwa, because you are trying to compensate, which will all compound on the pregnancy loss. Yes, so it is true that emotions can cause that. But also it is important, abantu abaliyo kuchetegereza, much as we know some of the causes, yes, there are about 80 to 90% of pregnancies that may be lost and the cause is unexplainable. Hinebe takumanya ngu twakuchebera byona twabichebera total stress ti hormones zawe zirije tokuresa nyinenda yawe rije twachebera DNA ninga chromosomes zona byabirije kunkenda yakorache
enda yarugamu konkatu nkabashaho tumukashobora
we can't put our finger on exactly what it is that has caused it. We call them unexplained or yet to be determined on unidentified causes. But just tokumanya somuntu ali eyo ngwe kitikumanyisa nguba kugambira ngu ekizibu titwakikwata kimanyisa ngu torazare ninga torafunenda ekoreki egumemu. There is always a way we can support omuntu oyine kwejo mu eraro bukirikare and then we help. Either wa rugwa mwenda then you get another one ozomu eraro bukirikare ko kumisinga period yawe ozeyo mshawo mshobore then mtandike jane ya antenatal and we see how to help.
Oh, thank you so much, doctor.
Yes.
Hariho omukazi ori kugirenda konka obwiro byabayinenda yajwa konkenda tiyaragamu uko kujwana kuba kwakoresirwa because we believe that when you get pregnant toshemerire kuba nojo mbwene nikiretwa kikushanga ngu omukazi ayinenda konka yajwa
ekyokubanza tariyo kujwa kuri nomo in pregnancy nkakuwa kigamba omukazi oyinenda should not bleed tashemerire kukora ki kujwa. So any bleeding that you get omuntu wena ariyeyo omukyara wena oriyeyo inenda kora arebe shagama watandika kujwa ozomu erwaro because there is no bleeding that is normal. Konka hariho reasons hariho enshonga bwencho omukazi nabaasa kukora ki ku bleeding ninga kujwa. Ekyokubanza hariho kitukweta implantation bleeding. Implantation bleeding nebaho within like 2 weeks omuntu ya conceiving and neba neruga manya fertilization ninga enkwanso na nihuri nebimeetinga omurusheke.
Yes.
So ende ine kuruga omurusheke ezo muriki omuri nyinenda and then ya implanting omu nyinenda. So there is that we call implantation bleeding where some people will see some spotting say 2-3 weeks on. But also there are conditions there are conditions that can cause bleeding. One of them is a type of abortion we call threatened. Threatened chimanyisa ngwenda nenda kukora nenda kuruga omuntu natandika kujwa nashasha and things like that nafuna nka cramping omundu omwe. So nobo ine kuza mu error because it can happen especially earlier on in the pregnancies. Yes. And we can stop it tubasa stopping and gumamu no kano okora no zaro mwana wawe. Then most of the people and azakozere like 5 months 6 months sometimes 7 months har whole conditions ezikubasa kuletereza omukazi kujwa. Ekyokubanza ine abaku kwatenda then ekyenyuma kyebembera omwana which we call placenta previa in medicine kibasa kuletereza omuntu kukora kujwa. Then ekyenyuma kyaruga ahanyinenda omwana takayikire kukora kuzaro. That is called placenta abruption. Nakyo nikibasa kuletereza omuntu kukora kujwa. Then ekindi sometimes infections especially urinary tract za UTI in case if they are very very bad someone can and bleed. Then abandi nibabasa kuba biine some lesions, I don't know how to call it in English. I mean in Runyankore, lesions ninga nka ebironda. I didn't want to say ebironda, but nke ebironda mnagwanyinenda and things like that. They can also cause some bit of bleeding. Then as the pregnancy goes, omukazi kakutanda kaleba and things like that, abantu nyinenda zikwatika, it can also cause bleeding. Those women of ruptured uterus. So it can stem from those very small things to the very big. So any pregnant woman should go to hospital. Omukazi weno inenda, once you bleed, please ozahirara.
Okay, yabari Dr. Kutushoboraje kurunji. Harho ntuire aha family planning, ntuire ntaka mwenu I had put nkatandika kosa family planning kugira ngo mbendekere kuzara. Konka ko najirenda yija yargam nargira family planning. No teka is it proven or is it true that family planning yenyima nebasa kureterenda yija yargam?
No.
It does not.
It doesn't happen. Family planning, how it works. Family planning regulates just hormones in kuretereza angu ombere gwa gutakuririza ngehuri. Some of them stop menstruation, so nichimanyisa angu akabubikanye nenda katakura and things like that. Even those that are hormone based. Konka ko kujistopinga, your fertility returns after some time, and once your fertility returns, the effects of the hormones have gone away.
Okay.
So no, there is no correlation.
Okay. Taketegereza doctor. Ninyebuza enda yaheza kurugamu. Nikintu arobwire bukwingana ki nyowe kugaruka kugezaho kugirenda. Obunshemerire kutwara ntakagarikire kugirenda.
Okay, thank you. Because that is one of the main issues actually. Because okurauka kugirenda area yarugiremu nacho is one of the risks.
Ntibasa kuretera nendisho
yarugam. Abokuba, I want us to understand that nkomwana kuzarwa ninga omwana kukura and everything ekyenyuma kine kukwata harike ahari nyinenda. Then wazara ntukiya muntu girango hati ekyenyuma cyashora and everything konka nikisigaho nkekironda. So ntaba hine kubanza hakora ki hachira. So na nokurugwa mwenda, it's the same thing. Even if the pregnancy hadn't reached that big stage. Konka, you have to give the body time. Nyinende banza yakora ki yachira properly. Then even the woman herself to get back emotionally, psychologically, and even physically, and be ready to conceive again. That doesn't mean the woman is not fertile though. Because omuntu wamara kurugwa mwenda, fertility returns within 10 to 14 days.
Yes.
In 2 weeks noba watandikira noba wajira munomo. But that risk increases chances of another loss if you get pregnant early. So to answer your question, omukazi aine kutwara a minimum of 6 months after pregnancy loss, because that means body yahirengereje, you have replenished all the minerals and everything, and you are now ready to conceive again. Okay. So 6 months or more. Yes.
Well, thank you so much, Doctor. Yebari kutwejesa ahabinte bukwatirine nana enda okuruga mukwazo nukutuka kubasa kubantu nutwerwa cyaba cyabireho ngo yarigiremo umukiraka ninyenda twereza umugisha abantu bace abari kubasa kurabamo batutera hasumu bagambe nitwe babuze umushaho eba kubasa kuba batayitegereza ninga ebitwa kubasitagambaho umukiraka no stera studio line zitu aha namba zitu 0 mshaji mukaga ashatunemwe 0 mukaga renda chenda narishi notutera namba ya Airtel 0 mshanju ina ananemwe nkaga na mwenda bitano inshanju n'itano ogamba nitwe ogamba n'umushaho umubuza hari icyo tukubasa kuba tutahikaho konkiwo kitubire nchikuria ninga kitubire nchikuteganisa no yenda kuchetegereza je kurunji. This is your chance kubuza umushaho revival
yabo wasibota
nasiba kurunji wasibota sebo
akibaje
twagamba noha
bagamba na Benoni.
Yes Benoni
Nenda kuanza kubasimiwa n'umushaho wabo kwigisha kurunji
ego yabareksima Benoni
kandi kibuze kintu kwenda kumbuza manyango mukazi yaba naza on period ariko batagire mukine effect impango ekumushara ninga
yaba twire nazo periods
then atakaza nka family planning then wato kasanga ya marugire gwindi atakizamo
yaza family planning
yes
konka cyatwaro bwire buringwa atari kuza umukwezi
yes
nonda kumanya cyabanci basa kureterenda kurugamo nari
kandi kindi ombana babishiki kana basa kutambuka mezi nkasha tata kuza mu period nchibanchirepe
okay deko ogume home shawo na ija kushobora
ari mukazi
Benoni nanda kwetegereza echo bitu niwe ino mugisha go kututera ukagamba nitukatubuze kibuze cyo tayetegereza je kurunji ninga echo tutagamba abo kuba ni bibiri byinji munonga revival
ukama sema
hasimu Yesu
Untese Justice cha Uganda
Justice cha Uganda
yego abade program
yewe bari kurikiriza
bari kutetera umushaho nene cyane no kusema abo mara mutetera abashira abo bakwa gisa nabo ko bari already abatakucenga kugira ngo bazo mwirwaro bamanya address bamanya ayiba kusangwa yeni cyende cya muheru ukwiza kucebeza nicyo twarase kwingana
ukwija kucebeza shi
yamenda kubiza kumshira na kumukambi naruba mwenda kuza kugenda no mukazi kucebeza akasente kingana
ashona Justice buri rwaro ndabariyene be yari yo mwenu tindukamya ngo konka nicabanchetenga ngo hikahirwaro ogambeho nabo nibija kushobora akabeyo kakwingana hata buri rwaro ndabariyene akabeyi karyo kare wishemo Justice yabari kututera revival
iriwe Petero kugakibona
wanji
iriwe Petero kugakibona
ego wishemo Petero
adachina nimbuza umukazi yana leta mizi ainenda leterenda je kurgam
okay guma ho Petero umshaho naza kugarakamu niwe no basa kugambaho nitwe utubuza hacubuzo cyo tayitegereza umbito abantu gambaho betu mwena batutera amasumu mwe bari kuba mu ruho revival
hello
wanje mukazi
nanyenda kubuza
no ntugamba no ho wishemwe
ndino wara
evidence watera ngayi
na tera mizina
ego evidence
nanyenda kubuza Nkata kondere namara kuzara umwana wanje
waba waheza kuzara umwana wawe
kunahereza kumuzara naza kondere yakahita ko mukono Dela hatu namara umwaka gumwe na mezana ntarukiza mu period nyenda kubuza nyenda kubuza na mazara umwaka gumwe na mezana ntakuza mu period nikibaza kundetera ubuzima bwishaho ni
gumaho evidence omushaho naija kugarakamu
Hello
revival
wasibota mukazi
nasiba kurunji wasibota
nasibaje ubuzima kambona nanyanze kukusangago kimwe kikinze
Ishimwe tunahurira izina ryawe
namanya Dennis kugaragaza umucukuri y'ikingiro
Yes Dennis
yo kinanyinda kubuzaho umwana aziruka hasi yamara cyatanje cyita so arongo rwari ya akamunonga akokera mu mabere y'umanye bakize
twakwataje kibuzo cyawe Dennis kigarikemu
naba nimbuza umwana kwa rukunga yonchero mu mabere byiza kumanya ikizuni kiza kirgangaye
umwana nayonchera mu mabere
kwa rukunga yonchero mu mabere
kwa rukunga yonchero mu mabere
ona saba dogita
twachenga no mshahoti yachenga tingumoko kubasa kuchishoboraje
umwana wenyine kuba nayonkanye nade na ukasanga amabera bw'umwana ukasanga ngo garama amashereka
amabera bw'umwana ngo garama amashereka okay okay gumaho wishemwe Dennis umshaho naza kugarukamo twaza kwatayo omwe umunyamugisha wa hamheru atubuze then umshaho tugaricemo Revival ego wishemwe Ruthi
anyenda kubuza ndosogwe nondo musikazire okani musinga period zanje munonga usanga ndi kumusinga neza ari ngasha
gakoratine
ande chindi no musiza konka nisingiro kwa kuma kumasezera na kwatenda
ndokora shi
nisingiro mwezi gumwe na kwatenda
umisingiro mwezi gumwe utajiri
na kwatenda kandi konga nchere unka umukurikimo kumbenze mesande mo kunagaruka kunakebera inda yabo
oyendo ejo kabocheberiza hirwaro ningo kabojechebize
arani ndire nechebiri
ukajichebera washangera umuka hwiresa ndemu wachebera washange tarumu
kuna herizo kwezi kumwe nachebera inda najikwata nagura kandi akasipa kandi nakachebera umukozi kumende nizemesande atako tukarakwase konka kuihe nyuma nsire mbuzuru wenda ndire mazure nyakena omumaka afite uzobe kimbire ndeba n'icyo cyo kumisinga period ngo umwe nazamu usanga namarama neza nkazire nzo period
okay gumaho oturichizo ushemwe Ruthi umshawe yaza kugarukamo okay mwe bari mnonga abatera amasumu kandi abatubuzaho umukiraka deko mshaho atugaricemo ebuzo ebyabuzwa kugira ngo twena tubase kwetegereza doctor twaza kutandukana na Benoni Benoni yagira if periods, family planning and not menstruating after miscarriage kuwaheza kurugwa mwenda wabura kuzo mu mitwe nikiretwa ki after miscarriage then the following month it takes time before you start menstruating
unless you're on family planning. If you're not on family planning, warugwa mwenda fertility usually returns within 10 to 14 days.
Okay.
But people that are on family planning, it is possible. Nchivasika omuntu okumisinga periods ze yali a family.
Okay.
Because some of the family plannings, especially as in hormones, nka akaita komukono, then akati komukono, akaita komulinenda, akine hormones, then na akakato, na pills nkezo. They have hormones, so is countering hormones zaweza aborijo, so you can take some time without going into your period.
Yabuza nikiretwa ki omushiki kumara amezi 3 either kazo mu mitwe for a long time ningo kashanga meza yamara amezi 3 atagire mu mitwe.
One of the things that causes omuntu obutakuza mu mitwe, what we call amenorrhea, is pregnancy. So now
the person is not pregnant, but she is not menstruating.
We have to check and be sure the person is actually
not pregnant.
Then ekyakabiri hariho conditions ezindi zinagambaho za PCOS, sometimes infections, stress and things like that ebikubasa kuletereza ki omuntu obutakuza omu mitwe. So the best idea or the best solution for them is omuntu ayine kuzahirwaro
go to the hospital.
What exactly could be causing it?
Petero yanabuza omukazi yareta bizi ainenda nikibasa kuretera enda yaragamu.
Yes, in fact that is one of the danger signs omuntu inenda, because enda ke kuba ekirinto then wareta mizi, it may be an infection, nebasa kuba infection because infections ezimwe nizija abantu nibareta mizi mabi ninga amezi gakununka nkebyo. Then enda ke kukura erenze emyezi 6 emyezi 7 omwana nabari omunsuha. So enswa ke kwatika amizi nikakora ki
gashohora
gashohora. So kagakushohora nkimanyisa ngo ubukoko nibasa kutayayira ogwo mwana konka na nekyamizi kusho na nekyenswa kwatika amizi gashohora nakyo nikibasa kutandisa ki ebisa. Then omuntu enda yaruga muteka kozire ki tekakire. So nikibasika. So it is very possible. So niwe Petero atwara omukazi omwirwaro.
Tuineho evidence yabuza kuyahereze kuzara yaza family planning konka yasiye mwaka gumwe and 4 months without periods. Is it normal? What akorechi?
It is normal.
It is
because she's using a hormonal method of family planning. It is possible for her to go without periods. Abokuba family niwe kukora ki niwe kukora family nebuza periods.
Okay.
Abokuba periods kezikubura nkimanyisa ngo tori fertile ninga talk shows huri erareta ki kara ruga family after some time period
nizakugaruka. Dennis owisinjiro yanabuza ngo amabere g'omwana nagarita amashereka. Why?
Hati nikiba heki abokuba omwana kakuba ari omunda yanyinenda ninga omunda yanyina, the hormones themselves be acting ninga nziba nawe nizimutaya nizimuzamu and things like that. So some babies they come out with breasts, with breast milk rather, or engorgement of breasts. Then nanabandi, especially the girls, come with some bit of bleeding. We call them pseudomenses because of the effects of the hormones. Okay.
Is it a bad thing?
We usually watch it. After some time the breasts reduce and the milk goes away. Then the other thing they need to do is to express okuganyika
amatega karagama amashereka gakaragama.
Yes, if that doesn't happen, or if the baby is getting fevers byatandika okumushasha mnonga bazo mwirwaro, the doctors will work on that.
Dennis omwana omutwaro mwirwaro. The last person, Ruth from Mitoma, she asked 2 questions. If you're still a girl, wabori yomushiki konka okumisinga periods to 2 or 3 months kutari ya family planning nichiritwa chi?
The body has systems. Okay, it's for the girls kokuba notandika okusoma mitwe system ejo ine kubanza yakora kyama chwarenga so kekuba netandika the body, for lack of a better word, starts with guesswork. So the body says, I think we are ready. So now we need to start doing this. Konka system eji nekubanza ya machuarenga, then umuntu abone kuzamu regularly. Konka abakutandika nka the first 2, 3, 4 years nizibaziri irregular. No basa kuzamu this month, no missing a 1 month, no zamu the next, then you miss like 2, then you go. So it is possible because it is the same thing. Echikubaho towards the end omuntu yaikomu menopause ninga almost getting into menopause periods are about to stop. Still the body now has to, it doesn't stop at once, so it goes on changing the cycle, the rhythms and everything until it eventually changes. So the girls, it is normal. It is normal. The first 2 to 3 months.
The last question is, she has been married for 4 years. There was no pregnancy. She missed periods for 1 month. Then after that month, yaterana n'omushaija we kahwire hakire yacheberenda yashangire positive. But after a month, she retested.
That's, first of all, one of the things she said was her periods are irregular.
Yes.
If I remember it very well. So one of the conditions that I talked about, PCOS, can cause those issues. So let her go to hospital and we find out why the periods are irregular. The periods irregular. Then the hormones that women have in their bodies sometimes is mimicking chirungo cha HCG chatukwata monkari. So it is very possible that you can get a false positive. And after some time it isn't, especially during your cycle.
Ruthi ozomwirwariro ochebeze. Dr. Hereza abantu namba yawe yesumu abatafuna chance yo kutuburiza on air. Bije bakuterre bakubuzeho.
Okay, enamba 0 8 0783 84 82 31. Abandi they come to